Hi, my name's Ian Harris. I'm a Professor of Orthopaedic Surgery at the University of New South Wales, and I'm the Chief Investigator of the CROSSFIRE study. You've been sent to this video because you're considering participating in the CROSSFIRE study. So what I'm going to do is take you through why the study is being done, who the study is being done on, and what is involved in participating in the CROSSFIRE study. So first of all, this is a study about wrist fractures, and it's comparing the two most common treatments for wrist fractures to find out which is best. Wrist fractures are very common, particularly common in older people over the age of 50 or 60, and they usually occur after just a simple fall onto the outstretched hand. And the two common types of treatment used are surgery using a plate and screws that you can see here, or manipulating or straightening and pulling on the arm and putting it in a plaster, like you can see here. But we don't know which one is best, and the studies that have been done so far have not shown a clear advantage of one over the other. So we want to do a high quality scientific study to compare these two treatments and find out which is best. So who is being studied? We're looking at patients who are aged 60 or more, with a certain common type of wrist fracture occurring after a simple fall. Patients must be fit for surgery, even if they don't have surgery, and patients must live independently. In other words, patients who are not currently in a nursing home. And patients should be available for follow-up for up to 12 months after. Now, even without the study, you will be treated with either surgery using a plate and screws or plaster where your arm is first straightened. But if you agree to be part of the study, and if you agree to be part of the randomized part of the study, your treatment will be decided by chance, and we use a computer to do this. We do this because it is the most scientific and the fairest way of comparing two treatments. Now, many people are uncomfortable with that part of it, and if you do not want to be part of the randomized study, you can be part of what we call the observational group. Now here you will still receive either surgery with plating or plaster, but your treatment will not be decided by chance, it will be decided by you and your surgeon. And some surgeons prefer to treat these fractures with plates, and some surgeons prefer to treat these fractures with plaster. Your third option is not to be part of the study at all, but of course your wrist will still be treated. Now, if you want to be part of the study, you'll need to read the patient information statement, which is here, and you'll have to sign a consent form. Then we'll ask you to fill out an initial questionnaire, but the only involvement in the study after that is that we will telephone you at 3, 12, and 24 months. You don't need to come back to see us for the study. The only visits you need to make and x-rays you need to make are part of your normal treatment. If we get more funding, we may contact you longer than 24 months, but the only contact will be by phone, and we'll be asking you questions about your health and about your wrist. Now, with any study like this, it needs to be approved by an ethics committee, and this study has been approved. And there's 4 considerations when doing this. The first one is that you need to be aware of the potential harms, and the potential harms of this study are to do with the treatments themselves. So there's specific harms that are associated with plating, such as infection, wound healing problems and damage to surrounding structures, but there's also potential harms with plaster, such as pressure on the skin, discomfort and inconvenience. The potential benefits of this study are mainly for future patients. If we can determine which treatment is better, we'll be able to guide the treatment for all future patients with these common fractures. Now, autonomy refers to your right to do as you please, and so this study is voluntary. Also, once you're on the study, you're free to withdraw at any time without any penalty at all. Privacy refers to your information. Now, we need to collect personal information on you in order to be able to contact you again. But no personal information will be released in any publications or presentations around this study. So that's an overview of the study. If you have any questions or concerns about your wrist, you can look at the videos we have on this website, but you should really speak to your treating doctors. If you have any questions or concerns about the study, you can speak to the study investigators that are with you now, or your treating doctors, or you can contact me, that's me there, by email, or the project manager Andrew, and that's his mobile number in his email. So thanks very much for having a look at this. Have a read of your participant information statement, which may answer some other questions for you. And if you're happy to be part of the study, please speak to the people that are with you, and you'll need to sign the consent form next. Thank you.